Did you know that if you're considering fertility treatments today, you're part of a revolution that's helping millions of people worldwide build their families? Whether you're thinking about IVF, wondering about egg freezing to preserve your future options, or trying to understand what sperm count really means for your fertility journey, this comprehensive guide will walk you through everything you need to know. The fertility landscape can feel overwhelming with all its medical terminology and complex procedures. But here's the thing, understanding these processes can empower you to make informed decisions about your reproductive future. Today, we're breaking down the 3 pillars of modern fertility science that could change your life forever. Let me start with something that might surprise you about IVF pregnancies. Unlike what many people think, IVF isn't just one procedure. It's actually a carefully orchestrated series of steps that typically takes anywhere from 5 to 8 weeks to complete. The journey begins long before you ever step foot in a fertility clinic. The first phase involves what fertility specialists call cycle suppression. This might sound intimidating, but it's actually designed to give doctors better control over your treatment timing. During this phase, which only applies to certain treatment protocols, you'll receive medications that temporarily pause your natural hormone cycle. Think of it like hitting a reset button on your reproductive system, allowing medical professionals to synchronize everything perfectly. But here's where it gets really interesting. Not everyone follows the same timeline. There are 2 main approaches, and the one you'll follow depends on your specific situation. The longer protocol takes about 8 weeks from start to pregnancy test, while the shorter antagonist protocol can be completed in approximately 5 weeks. Your body's unique response to medications will ultimately determine which path works best for you. The next phase is where the real magic begins, boosting your egg supply. Your body normally releases just 1 mature egg per month, but for IVF to be successful, doctors need multiple eggs to work with. This is where follicle-stimulating hormone injections come into play. You'll be giving yourself daily injections under the skin, and while this might sound daunting, most people adapt to this routine surprisingly quickly. During this stimulation phase, your ovaries will produce multiple follicles, tiny, fluid-filled sacs that contain your eggs. On average, doctors aim to retrieve about 8 eggs, though this number can vary significantly from person to person. Some individuals respond more vigorously to the medications, while others may need adjustments to their protocol. Monitoring becomes crucial during this stage. You'll be having regular internal scans to track how your follicles are developing. These appointments might seem frequent, but they're essential for timing everything perfectly. The medical team is watching for follicles to reach about 16 millimeters in size, which indicates the eggs inside are mature enough for the next step. When your follicles reach the right size, you'll receive what's called a trigger injection. This is precisely timed to prepare your eggs for collection and is usually given in the evening. The timing of this injection is critical. It must be administered exactly when prescribed to ensure the eggs are ready for retrieval. Now let's talk about the egg collection procedure itself, because this is often what people worry about most. The actual collection is performed using transvaginal ultrasound guidance, similar to the scans you've been having throughout your treatment. A thin needle is carefully guided through the vaginal wall to access your ovaries and remove the eggs from each follicle. You'll receive conscious sedation during this procedure, which means you'll be comfortable and relaxed throughout, though not completely unconscious. Many people don't remember the procedure at all due to the medication. The entire process typically takes only about 10 minutes, depending on how many follicles need to be accessed. What happens after egg collection is equally important. You'll spend a couple of hours in recovery, and the sedation means you'll need someone to drive you home and stay with you for at least 24 hours. Some abdominal discomfort is normal, and you'll be advised to take a day or 2 off work to rest and recover. While you're recovering, your eggs are beginning their journey in the laboratory. This brings us to one of the most critical decisions in IVF treatment, whether to use standard IVF or a technique called ICSI, which stands for intracytoplasmic sperm injection. The decision between these two approaches depends largely on sperm quality. If sperm count and quality are normal, standard IVF involves placing about 100,000 sperm with each egg in a carefully controlled dish. The sperm then naturally fertilize the eggs, mimicking what would happen in your body. However, if sperm count is lower or quality is compromised, ICSI becomes the preferred option. During ICSI, a single sperm is carefully injected directly into each egg using sophisticated micro-manipulation equipment. This technique bypasses any issues the sperm might have in naturally penetrating the egg. Both methods have similar success rates for fertilization. About 70% of eggs typically fertilize successfully. However, ICSI is more complex and carries a slightly higher risk of egg damage, which is why it's only used when necessary. This decision isn't always made beforehand. The final choice often depends on the quality of the sperm sample provided on the day of egg collection. Sometimes what looks like a borderline case on earlier tests becomes clearer when examined fresh in the laboratory. After fertilization occurs overnight, you'll receive a call the next day to learn how many eggs successfully fertilized to become embryos. This moment can be emotionally intense. It's natural to feel anxious about this call, but remember that even if not all eggs fertilize, you only need one good embryo for a successful pregnancy. Embryo development continues for several days in carefully controlled laboratory conditions. Modern IVF practices typically culture embryos to day 5, when they reach what's called the blastocyst stage. This extended culture period allows embryologists to better assess embryo quality and select the best ones for transfer. The embryo transfer procedure itself is remarkably straightforward. Unlike egg collection, no sedation is required. Using ultrasound guidance, a thin catheter is passed through the cervix to deposit the embryo directly into the uterine cavity. Most people describe it as similar to having a pap smear, perhaps slightly uncomfortable but not painful. You can return to normal activities immediately after transfer. Contrary to popular belief, bed rest doesn't improve your chances of success. In fact, maintaining your normal routine is encouraged, though you should avoid anything too strenuous for a few days. Now, what about those extra embryos? If you're fortunate enough to have good quality embryos remaining after transfer, they can be frozen for future use. However, this only happens in about 40% of cycles. Not all embryos are suitable for freezing. Only those of sufficient quality are likely to survive the freezing and thawing process. The freezing technology used today is called vitrification, which involves ultra-rapid cooling to extremely low temperatures. About 85% of frozen embryos survive the thawing process, and frozen embryo transfers have pregnancy rates comparable to fresh transfers. Let's shift gears and talk about egg freezing, which has become increasingly popular as more people choose to delay childbearing for career, educational, or personal reasons. Egg freezing follows many of the same steps as IVF: hormone stimulation, monitoring, and egg collection. But instead of immediate fertilization, your eggs are frozen for future use. The key to successful egg freezing is timing. Egg quality declines with age, particularly after 35, so freezing eggs in your 20s or early 30s provides the best chance of future success. However, it's never too late to consider this option. Even eggs frozen in the late 30s can result in successful pregnancies later. The process involves the same hormone stimulations and monitoring as IVF. You'll need about 2 weeks of daily injections and regular clinic visits for monitoring scans. The egg collection procedure is identical to IVF, and recovery time is the same. One important consideration with egg freezing is that not all frozen eggs will result in babies. On average, it takes about 10 to 20 frozen eggs to achieve one pregnancy, though this varies significantly based on the age at which eggs were frozen and individual circumstances. When you're ready to use your frozen eggs, they'll be thawed and fertilized using IVF or ICSI techniques. The resulting embryos are then transferred, just like in a regular IVF cycle. Many people find that having frozen eggs provides tremendous peace of mind. knowing they have options regardless of what life brings. Now let's address sperm count, which plays a crucial role in both natural conception and fertility treatments. Sperm count refers to the number of sperm present in a semen sample, but it's just one part of a comprehensive semen analysis. A normal sperm count is generally considered to be 15 million sperm per milliliter or more, with a total count of at least 39 million per ejaculate. However, numbers alone don't tell the whole story. Sperm motility, how well they swim, and morphology, their shape and structure, are equally important. Low sperm count, medically termed oligospermia, affects millions of men worldwide. Causes can range from lifestyle factors like smoking, excessive alcohol consumption, or heat exposure, to medical conditions such as varicoceles, infections, or hormonal imbalances. The good news is that even with very low sperm counts, pregnancy is often still possible through assisted reproductive techniques. ICSI has revolutionized treatment for male factor infertility, as it requires only one healthy sperm per egg. Even in cases where no sperm are found in the ejaculate, surgical sperm retrieval techniques can often recover sperm directly from the testicles. For men looking to improve their sperm count naturally, several lifestyle modifications can be beneficial. Maintaining a healthy weight, eating a balanced diet rich in antioxidants, exercising regularly but not excessively, avoiding smoking and excessive drinking, and managing stress all contribute to better sperm health. Supplements like folic acid, zinc, and vitamin D have shown some promise in improving sperm parameters, though it's important to discuss any supplements with your healthcare provider first. Temperature also matters. Avoiding hot tubs, saunas, and tight clothing can help maintain optimal sperm production conditions. It's worth noting that sperm production takes approximately 72 days from start to finish, so any lifestyle changes you make today won't show results for about 3 months. This is why fertility specialists often recommend making improvements and then reassessing sperm quality after this time frame. Throughout all these fertility treatments, emotional support is crucial. The journey can be physically demanding and emotionally challenging, with periods of hope and disappointment. Many clinics offer counseling services, and support groups can provide invaluable connection with others going through similar experiences. Financial planning is another important consideration. IVF costs vary widely depending on location and specific treatments needed. Many insurance plans now provide some coverage for fertility treatments, though coverage varies significantly. Some clinics offer payment plans or financing options to help manage costs. Success rates for IVF vary based on multiple factors, particularly age. Women under 35 have the highest success rates, with pregnancy rates often exceeding 40% per cycle. However, success is possible at any age, and advances in technology continue to improve outcomes across all age groups. The field of reproductive medicine continues to evolve rapidly. New techniques like pre-implantation genetic testing allow for screening of embryos before transfer, potentially improving success rates and reducing miscarriage risk. Time-lapse embryo monitoring provides better insight into embryo development, helping embryologists select the best embryos for transfer. Looking toward the future, research into artificial intelligence for embryo selection, improved freezing techniques, and even artificial wombs continues to push the boundaries of what's possible in reproductive medicine. Whether you're just starting to think about fertility preservation, actively trying to conceive, or somewhere in between, understanding these options empowers you to make informed decisions about your reproductive future. The science of fertility continues to advance, offering hope to millions of people worldwide who dream of building their families. Remember that every person's fertility journey is unique. What works for one individual may not be the right approach for another, and that's perfectly normal. The key is working with qualified healthcare providers who can assess your specific situation and recommend the most appropriate treatment path. If you're considering any of these treatments, don't hesitate to schedule consultations with fertility specialists. Most initial consultations provide valuable information, even if you're not ready to begin treatment immediately. Knowledge is power, and understanding your options is the first step in taking control of your reproductive future. The journey may seem complex, but with the right information and support, millions of people successfully navigate fertility treatments to achieve their dreams of parenthood. Your story could be the next success story in this incredible field of medicine.